My name is Jit Kong, and I'm a professor in the Mathematics and Statistics Department at York University and the director of the Africa-Canada Artificial Intelligence and Data Innovation Consortium. I'm equally the principal investigator in the IDRC and the CEDA sponsored project under the Global South AI4COVID-19 response program entitled Predictive Modeling and Forecasting of COVID-19 in Africa using Artificial Intelligence. The countries of impact include Botswana, Cameroon, Eswatini, Namibia, Mozambique, Nigeria, Rwanda, South Africa, and Zimbabwe. Thanks to this project, we have helped policymakers and the public in this country to monitor the spread and growth of COVID-19 within each local community. Equally, thanks to this project, we have equally helped them to identify emerging hotspots. This project has equally helped in predicting upcoming peaks and their intensity. Thanks to this project, we equally developed an AI-powered toolkit for contact tracing. We equally, with the help of this, thanks to this project, we were able to identify gender vulnerabilities in the data set that this project helped us to collect. And through that, we advise policymakers on how those vulnerabilities could be addressed. Thanks to this project, we equally helped inform closures such as school closures, business closure. We equally, thanks to this project, were able to help optimize vaccination rollout strategies in these countries. Thanks to this project also, we were able to inform the allocation and the purchase of healthcare resources. And we equally help local stakeholders to address mis and disinformation about the prevention and treatment of COVID-19 and COVID-19 vaccination. Equally, thanks to this project, we're able to provide a near-term forecast of the labor market flow. This is, to my knowledge, the first of its kind in the continent that have buy-in from government, local traditional rulers. Instead of using the top-down approach that science have been using in the continent and providing things that end up in papers, we went forward with a bottom-up approach where we decided to go with the tools that we had and say we had tools, had a conversation with traditional rulers, community leaders that knew what or that are aware of what is happening in their communities. We have politicians in our midst and all policymakers, and we said, these are our tools. What is the problem? And they brought forward the problem, and we worked together in the consortium to provide solutions to those problems, to come up with models. And gradually, we informed the collection of data from the community and ensured that the data was locally relevant. And as we came up with the solution that was implemented in this community, we got feedback, and these people were always on the table. They ensured to use it because they came up with those solutions themselves. They felt like they were part of something. And it's very important when you make people to be part of something that's going to save their life and ensure that in an ethical way, the data is collected with their input. The model is developed with their input. And the politicians knew why the models are developed, why they needed it, because they are part of the consortium. To me, this is very unique in Africa. Nothing like this before. I grew up there, and I grew up in the continent, and I've been really involved in modeling the continent, and nothing like this has ever happened before. One other great thing was the expertise that we brought on the table. We brought in people with expertise in community engagement, citizen science, artificial intelligence modeling, global health, disaster management, and with all these experts on table, we were able to provide the solutions that the continent needs. Another thing that is unique about this project is the learning from each other. This is not normal in the continent. Scientists tend to be very local and stick to the local community, what they do. But we were able to bring in 9 countries, several institutions, several research centers, and people are able to learn from each other. For instance, when somebody is able to implement something in Nigeria, in South Africa, or in Cameroon, somebody in another country can learn from that and use locally relevant information to carry out the same process, and it makes it very easy and faster because other people have implemented it. So this collaborative work is something unique, and this helped a lot in addressing some of the COVID related concerns within this country or COVID related issues. So this is something unique about this project. So overall, the fact that we used a bottom-up approach, we had politicians and the community leaders present in the decision making, instead of the top-down approach that science has always been using, was very helpful in solving the COVID-19 related problems in the continent. Secondly, the expertise that we brought on the table was really helpful, and also the fact that we were able to learn from each other has been very, very helpful and has led us to the success that we have achieved in the continent.